We salute our soldiers in uniform on the borders. We also do so for the doctors who are fighting an equally daunting battle against the coronavirus around the world. With a prayer on their lips for the doctors, today's episode is dedicated to them, the corona warriors who are not only facing the uphill task of handling patients but also fighting to keep themselves emotionally and physically well to continue unabated till the virus gets defeated. While some doctors stay outside their homes for months, many sleep in cars so that their family, that include maybe aged parents and children at home, remains safe. Many feel exhausted and run out of patience as there seems no early date of the virus declining in its virulence. Wearing the personal protection equipment and masks for long hours is no easy task. Neck-to-toe gowns, shoes, caps, N95 masks, goggles and double gloves, all of which are airtight. Still, there is no certainty that they're protected. Some doctors have said wearing so much of gear itself is exhausting. Given the expenses of the PPEs, most do not go to the loo to ease themselves as infections could spread anywhere and they need to change the PPEs. Doctor couples are staying away from each other and the families, the children. Soaps, whatever may be, are no consolation even if it's monetary or doubling or early dispersal of salaries. Women doctors who have periods also go through all odds if they start bleeding in the mid of the duty, as it would involve a number of protocol in changing a gear, asking a reliever who would also need a gear, and then joining back with another gear. PPEs are not reusable at all. People with other ailments continue to visit hospitals, and there has also been a surge in the number of people who are turning up at hospitals with coronavirus-like symptoms. Most hospitals who have separate coronavirus disease ward, ICU and a dedicated medical team supposedly are expected to work for 5 days and then quarantine for 7 days. But how many hospitals, both COVID and non-COVID, follow the protocol is a big question. More pertinent is, do we have as many medical practitioners to follow the roster and quarantine? More pertinent is, do we have as many medical practitioners to follow the roster and quarantine? A doctor takes approximately 6 to 12 years to acquire the necessary qualifications. Thus, the total stock of doctors in a country cannot be increased quickly in the short run. While many doctors have lost their lives in line of duty, many have battled hard to survive. There are many instances where they are being attacked and ill-treated. It is not just those working in COVID-19 wards who are on the front line, but also the doctors, community health workers and officials who are involved in contact tracing and screening suspected patients by going door to door in virus hotspots. At a time when flattening of curve is seen as the only hope, all that the doctors want is for people to maintain basic distancing and mask wearing rules so that they're not overburdened with more affected patients. There is fear, there is psychological upheaval, there is stress, still they keep working. Despite being vulnerable, these healthcare professionals bravely fight to save the nation. On Doctors' Day, we are grateful to all in the medical fraternity, particularly the medical practitioners, for their dedicated service in the greatest fight against coronavirus.
नमस्कार, मु पूजा। मोर विश्वास आपनकु ए वीडियोटी भल लागिथिबो। आमकु लाइक, शेयर और सब्सक्राइब करबा को भूलंतुनी। लेटेस्ट अपडेट पाई देखुथांतु ओटीवी।